Today we focus a little bit on the emotions of this all. How much more difficult will this be if we don't see a significant slowdown in the number of cases? Difficult for the nurses, difficult for, of course, the frontliners, but also everyone at home.
Sure, that's a great question. As you mentioned, our nurses, our physicians, all of our healthcare workers are working around the clock right now to try and fight against this virus. And what we've seen after other disasters, like I'm thinking, for instance, hurricanes or tornadoes, or the tragedies that we all experienced around 9/11, there are these fairly predictable phases that we go through collectively. And it starts with the impact of the disaster when it first hits. We're going to experience fear and confusion, right? This sounds very familiar to us, right? Difficulty believing it's even happening. And we make extraordinary efforts to protect ourselves and safeguard ourselves and our families. And then we move into what we see as kind of this heroic phase when we have a great deal of activity happening, our adrenaline is surging, we're all ramping up to help. And it moves quickly into what is called by many as this honeymoon phase. We're bonding back together, and disaster assistance is coming online and is active. We're optimistic. We're going to get through this. We're going to get back to normal quickly. And unfortunately, that doesn't last long. And we tend to move into disillusionment. We realize what those limitations of our disaster assistance is, and we've been working so hard, it becomes extraordinarily exhausting physically and mentally, and negative responses to those stressors start to come out. When that demand for help starts outstripping our resources, it makes sense. We feel lost, we're abandoned, we feel angry, right? And that can take months to years before moving into reconstruction or recovery phase.
So, Professor, what is the number one advice to actually try and bolster each other, but also for people on the front line in this very difficult time?
Sure. Right now, we're somewhere between a honeymoon and disillusionment, right? And we're kind of moving back and forth between those. We have many who are really maintaining an optimistic stance, and communities working together or providing whatever they can to fight this virus. We're also seeing increasing conflict and voices of those wanting to move on, to open back up to businesses. We have those who are tired and angry and worried, and they worry they don't have what they have to safely continue, and they're physically and mentally exhausted. They realize very much so that this is a marathon. So bolstering each other will require actively caring for ourselves and each other, continuing to advocate for increasing supplies, increasing testing, supporting our leaders developing vaccines. But it's okay to know it's okay to not be okay right now. Continue to reach out to others from a safe distance. Take advantage of our electronic devices to connect, and really watch out for our friends, our families. Look to spiritual advisors, therapists, and it's okay to breathe. It's okay to cry, and to keep moving forward.
Michelle, one final question, if I could. The president overnight decided he's going to put out an executive order limiting or banning immigration into the United States. He talks about the threats of the virus, the invisible enemy that's out there. I was thunderstruck to learn that 29% of doctors and 23% of nurses are immigrants. How do those nurses become nurses in the United States? Do they just show up and they're hired? Or is there licensing? How does that process work at your Johns Hopkins University?
Sure, yes. From time immemorial, we have relied very heavily on a wonderful workforce that comes from everywhere across the globe. As we have individuals come to our country who have practiced nursing in other countries and want to continue to do that here for us in the United States, we do have, each state has a different board of nursing that provides licensure for those individuals. They will have to take a licensure exam to show that they have that background. And there are also opportunities at various colleges and universities in the event that they may be lacking something that was needed for that licensure, that they can take that. There also are many programs that encourage folks to come from other countries and help support them in that transition. It's worrisome to have limitations at this point when we so desperately need folks on the front line to turn away those who have those skills and resources.